car ran a red light. He hit it, bruising just to the upper collarbone.
What hit this?
The metal drip edge, galvanized steel edge of a roof.
The car came and I hit the car.
For getting hit by a car, he will do very well. I think he got very, very lucky.
She had an acute heart attack. It's a pretty big one.
Sixth visit since August 1st.
Well, welcome to Colorado Springs.
Penrose Maintenance Rose with AMR Medic 14. We're in Rapture, so we're not emerging. Got driver of a car today going about 20 miles an hour. A car ran a red light. He hit it. Moderate front end damage. No intrusion to the vehicle. Windshield intact.
For more than 125 years, the doctors, nurses, and staff at Penrose Hospital have been caring for the people of Colorado Springs. The front door of the hospital is often the emergency department, where each year more than 50,000 people come seeking emergency care. While primetime dramas may give you an idea of what life is like in the emergency department, we want to show you the real ER. This behind-the-scenes look will introduce you to the people who work there and give you a glimpse of what really happens beyond the waiting room at Penrose Hospital. Working in the emergency department, you never know what will come through the doors next. Dr. Johnson starts his day taking care of a man who was involved in a car versus bicycle crash.
So it looks like paramedics just brought in a gentleman who, for all practical purposes, was hit by a car. Well, actually, he hit the car. He was a bike rider and appropriately helmeted, which is always a good thing. But a car pulled out in front of him. He was not able to really stop, so he kind of T-boned into the car. The front quarter panel sounds like he rolled onto the hood, kind of stopped on the windshield. Sounds like he's very lucky. His only complaints, the paramedics are saying, are abrasions and some cuts on his arm. So we'll go take a look. You're riding your bike, and you're wearing a helmet, and the car comes and hits you?
No, well, the car came and I hit the car. Couldn't stop. Yeah.
So it kind of cut you off in front of you.
Exactly.
You couldn't stop.
Yeah.
You hit the car. You roll onto the hood, the windshield, and that kind of is where you stop.
Yeah.
Sounds like.
Fell, hit my shoulder on it
Okay.
first. So.
Tell me where you're hurting.
So right now my hand feels the worst, but I guess I have some deep cuts on my shoulder and on my arm.
You were able to get up and walk around?
Yeah, I hit, and then I was on the rebound. I was staying. So.
They mentioned you hit your head, but you were wearing your helmet.
Yeah, so I didn't feel it.
No loss of consciousness?
No.
No vomiting?
No.
Deep breath.
After being hit by a car while riding his bicycle, this patient is very lucky that his injuries weren't more severe. Wearing a helmet almost certainly prevented his injuries from being much worse.
Luckily, I think you are actually a very lucky guy. This is obviously kind of road rash here, and we're going to get this cleaned up. Make sure there's no big cuts underlying all this here. You've got a couple cuts here that probably could use a couple stitches each. Okay. That we'll put back together here. Give us some time. We'll get this cleaned up. Take a look, make sure there's nothing bad going on. Get this fixed up. Kind of go from there. Cool. Sound like a plan?
Yep.
Okay. Any questions or anything?
Nope, not right now.
Okay. Okay. We'll get that going.
And I'm Mr. Tingley.
Hands are.
Okay. So just wound care and suture setup. He'll do great. For getting hit by a car, he will do very well. I think he got very, very lucky, despite his horrible story of getting hit by the car, rolling on the hood, hitting a windshield. He was wearing protective gear, including a helmet, which did him very well today. So.
You can talk to him and say, Dad, why don't we just call the ambulance?
Only minutes later, a woman comes in having a heart attack.
This woman is having a very large heart attack. She walked into triage, came by private vehicle, and they did an EKG out in triage, which shows that she's having a heart attack. So we're going to wait for her to come back and take a look at her. Okay, so let's do a heparin bolus, aspirin. Okay, and depending on what her blood pressure is, let's get some low pressure. Low pressure? Okay. Just in case. And we have a first blood pressure. Just right.
And then I'm going to do a quick x-ray. You guys ready?
Yep, we're ready. Okay. And then I'd like to see the image.
Got it.
When treating a heart attack, Dr. Bronski knows that time is muscle. He and the team work quickly to stabilize this lady and get her to the cardiologist who will open the blockage in her heart vessel.
In a heart attack, the heart muscle is basically losing oxygen. In a traditional heart attack, the way that we think of it, it's because there's a clot in one of the vessels that supplies the heart. And when that clots and the heart muscle is not getting oxygen, it basically stops functioning. And without your heart, you can't pump the blood in your body, you can't live. This is all going to happen very fast here, okay? And we're going to be bringing you upstairs in just less than 1 minute. And every minute that goes by, those muscles are dying. And so it's very, very important to get those people to treatment immediately, absolutely as fast as we can. And so we can just get her straight upstairs and get that vessel opened in what they call the cardiac catheterization lab. And so the goal is to spend as little time as possible down here doing things and just to get her upstairs right away. In the emergency department, typically we're not providing the definitive care for trauma patients. We're providing some sort of stabilization measures. We may put a breathing tube down them, or we may evacuate blood from their chest or air from around their lungs, or reset a leg or another limb. But ultimately they're going to need the definitive care for that. So the emergency department only serves a purpose of one link in the chain for the patient care.
Each year, thousands of kids are brought into the emergency department at Penrose Hospital as a result of fall, bicycle crash, or other traumatic injury. A 5-year-old boy is brought in with a broken arm from falling off a playground structure.
Well, the school would only say he hurt his arm. So I didn't know if it was broken. I didn't know if it was just a scratch that they wanted. They were overreacting. So she texted me. She goes, "What hospital?" So I knew there was something actually broken versus just a bad scrape. Broken and it pulled away from here. So they pull it out. The front bone and the backbone are broken.
I was going down on it and then I fell down.
Oh.
Just got a 2-bone fracture through his forearm right there. Fell on outstretched hand like that. Popped them both up a little bit. So cool. Be good. Just gonna have to pull a little bit, straighten them out, and split them. So. Yep.
Yeah, he has to go see an orthopedic in the morning. He broke both bones. He fell off the playground equipment. So right now they're getting ready to set it. First time he's been in the hospital besides to see someone that was sick or being born. So.
So what we're gonna do,
I'm gonna hook a tube up to your IV here, buddy.
we're just gonna give you some medicine here in just a little bit that's gonna make you really sleepy, okay?
What's it going to do?
It's just gonna make you night-night. So they can fix your
So we
rhythm.
can fix your arm. And then after we
Mommy,
fix your
no,
arm,
relax. Mommy's gonna stay here the whole time. You're okay. Do you want to ask the doctor what he's gonna do to fix it? Sit
we're
up.
gonna give you some medicine.
I got yours.
It's just gonna make you sleepy, okay?
We're all ready. We're ready.
Was that for
And
the
we're
camera?
gonna put a big splint on your arm.
No, don't shoot me. I'm just gonna get a side face jack if you do that.
We're
did
just
not
gonna
put his
put you to sleep so you don't have pain. And then we're gonna fix your arm. We're gonna put you in a big splint.
What is that?
I'm sorry. You want to start? Yes.
The arm needs to be set immediately, or he risks having issues as he grows up.
Here are mats to do any procedure.
He's given a sedative, so he doesn't feel anything as Dr. Jack Sharon comes in to set his arm.
This would really do care of you. You just rest your arm right there.
I'm right here. In a minute.
You gotta hold his hand and I'll get out of your way. Get out of the way. You did great as well.
Not my first rodeo.
Yeah, there you go.
Done.
All right, I'm gonna order some stuff on VT2.
I like the diversity in emergency medicine. You never know what's going to come through the door. We work with all socioeconomic classes, all races, all everybody. There is no limitation in what happens in the emergency room. Although the other day we did have
I heard you had a heck of a day.
A delivery in this room, and right next door, trauma arrest, like 5 minutes later, and the next one was a septic patient, and I was like, wow.
Yeah. Here's one for you. I told you to go back to the...
Yeah. Once we get it cleaned up, we'll have a little better idea. I don't think so. Let me see your hand. We did a laceration repair of the patient's left shoulder. He had 3 approximately 2.5 centimeter lacerations. So lacerations were numbed up with a numbing medication called bupivacaine with epinephrine, which is a longer acting numbing medicine, and it was cleaned thoroughly. Then we put about 3 stitches into each laceration. There was a total of 3 with a total of 9 sutures. Patient tolerated procedure well period, total of 9 sutures placed period. Discussed return precautions and wound care with patient period. All questions answered period. Stable.
The man who was hit by a car was fortunate to receive only 9 stitches and is ready to go home.
So you are bruised, banged up, scratched up, real good, but you're a lucky guy. And you're going to walk away from this with just a couple cuts on your shoulder, okay? Tylenol and Motrin will be your friends. You can take both at the same time. Okay. And they work in different ways, so that'll kind of get you moving in the right direction, but I think you'll do just fine. Cool. We're ready to cut you loose if you're ready to go.
Yep.
Sound like a plan?
Sweet.
Okay, get you ready to go, man, okay?
Thank you very much.
Hang tight.
All right, so nurse will be in here shortly with the discharge paperwork, and that'll happen.
She has an Atrial Flutter. I guess she has a history of it.
Dr. Bronski's next patient is a woman whose heart is beating too fast. She has been seen before for heart problems, and Dr. Bronski wants to find the cause.
We have a lady that just showed up to triage that has a very, very rapid heart rate in the top part of her heart, which are called the atrium. And so we're going to get her right back to her room and find out what her history is with this. It may be something that we will just medicate and slow down. It also may be something that we're going to use some electricity to shock her back into a regular rhythm. It all depends on many factors that we'll find out from her shortly.
Heart disease is the #1 killer of American women. Dr. Bronski knows how important it is to make sure this patient understands what's happening to her heart.
Thursday from the hospital. And that evening I had this again.
Okay.
So then I had it again the last Thursday night. But it was only a minute or so.
Okay.
So then today it lasted.
It lasted and it didn't go away.
I waited 10 minutes before I called my son to come and get me. So.
Okay, great. And so your heart is in it was in a rhythm called atrial flutter.
Yeah.
Okay. And so
what is it now?
Right now, it actually has gone back into sinus. Which is what we want it to be.
Well, it's gone up and down.
Yeah. Yep. If your heart goes back into that rhythm, then what we can do is either try to give you more medicine to try to slow it down, or we can potentially, depending on the circumstance, sedate you and give you a little bit of electricity to the heart. Did they have to do that last time? Okay. And I'm thinking now, actually just between the time that I started listening to you and now, your heart's gone back into this regular rhythm. And so I'm not thinking that we need to do that. All right, we'll take care of this, okay?
All right.
Okay. Her heart spontaneously went back into a regular rhythm, and which is good for her. And so we're going to give her some medicine to try to keep the heart rate down a little bit lower, and see and make sure that she doesn't convert back into that irregular rhythm. So, right.
Blood pressure is 92 over 46. Heart rate is probably around 60. I'm going to clear reading on SpO2 at this point. GCS 15. Currently lung sounds are clear. We'll be there in probably about 10 minutes. Any questions?
No questions from on arrival. Thank you. 9.55 since last night.
She's been having chest pain.
Emergency room nurses work in a fast-paced environment, treating patients who need immediate medical attention, such as victims of car accidents, gunshot and knife wounds, heart attack, stroke, and other life-threatening injuries.
I like the fast pace. I like the variety. It can be very trying at times, but there's the periods where it's very rewarding. I kind of grown up not knowing that I could make a difference, and once I realized I could make a difference doing healthcare, I just kind of traveled through the chain. CNA work, and I did hospice and worked my way up through nursing school, and that's just where I fell and where I fell in love. So I love it.
As with most emergency department physicians, Dr. Bronski enjoys the variety of things he gets to do each day. After just caring for someone with heart problems, he now begins taking care of a man who came in with a severe laceration on his hand.
So this gentleman cut his hand on a piece of metal, and it cut right through one of his tendons. So he's able to make a fist, but as far as extending his fingers back up, which require the tendons on the backside of your hand, he cut right through that, so that finger doesn't go up. And so we need to take a look at that. And so let's go chat with him. Get a closer look at this here. I like your splint. That was good thinking there.
I did want the tendon to retract back in.
Okay, all right.
And
And again, what hit this?
the metal drip edge, so
Okay.
the galvanized steel edge of a roof.
I want you to bend your finger right there and then straighten. Okay, bend and then straighten, bend and straighten. Okay, now we're gonna make a fist and now come back up. All right. Okay. And so I can't see it right there, but you obviously cut right through that extensor tendon. Okay, and so what we're going to do is we're going to get an x-ray. All right, and let me numb you up a little bit now that we've made sure that you can feel where you can and can't feel. And let's make sure there's no foreign body in there, which I doubt, but we also need to know if it nicked the bone, because that kind of changes. What we do is we numb it, and then we irrigate it.
Thank you.
That way it's a little bit more humane for you. So what I do is I go inside where it's already cut, so that we don't have to go through the nerves on your skin, okay? And all right, are you all right sitting up?
I'm all right.
Okay,
I'm all right.
All right, if you feel lightheaded or dizzy, you need to tell me.
No.
Okay, all right.
No fear of needles, but I've been in situations where I've had to be basically first on scene for people, and I'm usually okay until the trauma is over and there's treatment. Then I have to go sit and barf for a little while. So.
Well, you are very much like most of the population. All right, so I just talked to the hand surgeon who's on call, told him what was going on. So what we're going to do is not much here. We're just going to make sure he doesn't have a foreign body or some sort of contamination in his hand, and then we're going to splint him in the completely extended position, and then we're going to send him right over to the hand surgeon's office, and they're going to do it in the office today. So
it's a little nerve-wracking because I'm a mechanic by trade, and this is my dominant hand and kind of my life, so that's about it.
We can see that there's no obvious evidence of a fracture through the bone, and there's no obvious evidence of any type of radio opaque, meaning that it shows up on an X-ray object, which would show up as a bright white or kind of dull white shape here if there was a foreign body. We get multiple angles on the hand to look, and nowhere on there do we see anything that's obviously cracked or something that doesn't belong in his hand. We're going to irrigate that out, okay? And then literally what we're going to do is put a non-stick dressing over it. We're going to put a splint on that so it stays, even though I like yours better. But and then Paul talked to one of the hand surgeons here, and he's gonna be waiting for you at his office, and he's gonna repair that.
Thank you.
Today.
So we were just irrigating. So after you cut a wound, you can get a little bit of dirt, you can get gunk up in the wound. So after they numb it up, we just irrigate with a lot of saline and to clean it out. And then bandage it. Sometimes they'll get sutures. In this case, he's going to follow up with a hand specialist. But we just do that to make sure that to decrease the risk for infection. In addition, we'll make sure that their tetanus is up to date too.
Differential diagnosis would include skull fracture, intracranial hemorrhage, cervical spine fracture, rib fracture, pulmonary contusion, hemothorax, pneumothorax, splenic injury, period.
For the official read from radiology, it certainly looks better, so we should be able to get you home here pretty quick with a little bit of pain medicine and some instructions on taking care of his splint. It's not likely that he broke his arm, but it's good he's got a good hand doctor that's going to take care of him. Yeah. Okay? All right, you're almost there. Thank you.
Everyone will tell you what makes the ER work is teamwork.
There's a list of things that need to happen in a certain order. What's nice is that we all know what's on that list, what all needs to be done. Everyone's actively looking to see what roles need to be filled, and then they'll step in when they see the roles that need to be filled.
In the emergency department, like many other places, the team is vital. I personally don't view any hierarchy in the emergency department. I don't care that I'm a doctor and that the person next to me is a nurse and the next person next to me is a tech and that the next person to me is the housekeeping. To me, every single one of those people plays an absolutely vital role in keeping us functioning, and not any one particular person, no matter how much education that they've had or what type of education that they've had, can do this all alone.
There's not a whole lot of jobs where you get to do something exciting with your friends. We're all chipping in, whether it's a code, whether it's a flight or a STEMI.
You can have a disagreement with someone and you know that once that cardiac arrest rolls in or that difficult patient, they have your back regardless of what your personal feelings are. And it's just like family should be. You know that person's going to be there through thick and thin, and I think that's the way we roll in the ER here.
If it was left up to the doctors, we wouldn't be able to do it. If it was left up to the nurses, they wouldn't be able to do it. We need the techs, we need the housekeepers, we need every single person that is part of that team. If any one of those links falls apart in that chain, then we fall apart. And so I just view it as a big family and a big team.
It's like a second home. Like, I leave my family at home and I come to work and it's my home. The teamwork and everything we do to work together to take care of the people we have, it's amazing. I've never worked anywhere else like it.
Flight for Life has brought in a man from St. Thomas More Hospital in Canyon City who is having a heart attack. Time is critical to get the man to the cath lab.
Hi.
Good afternoon.
Hello, sir. I'm Ben RN. I'm also an RCIS. I'm from the Heart Cath Lab. I see you had a stent in 2013.
Right.
Let me officially meet you.
Yep. Right.
Good. And you had a heparin bolus.
And then heparin route, and then we restarted it up here.
All right, so 4,000. All right, are you nauseated or anything?
No.
Chest pain?
Yes.
On a 0 out of 10 scale, what are you?
I'm still about a 3 right up in here. This here quit.
Okay.
Right in here.
Are we okay to go?
Yes.
Okay, well, let me hook you up to my monitor. We're going to rock and roll.
and he was able to go directly from here right up to the cath lab where the cardiologist is waiting, and they looked at his vessels around his heart, and indeed he was having a pretty significant heart attack. He'd occluded one of the major blood vessels that supplies blood to the right side of his heart, which led to the EKG changes and heart attack and things like that. From what I can tell, looking at his notes from his cardiologist, he's doing well. They were able to get that opened up and get the blood flow restored to the heart, so always a good thing. So he should be moving in the right direction too.
Are you checking out? Now what's the last name?
The environmental services team plays a critical role in making sure the rooms are clean and ready for the next medical emergency that comes through the door.
Sharon, our housekeeper. That's who we call the boss.
We all say Sharon runs the department. And it's true. The EVS work crazy hard.
They see the importance of their job just as much as we do. Nobody wants to come to a dirty ER. So when they come in there, it smells good, it looks clean.
That's why they said I'm the boss in here. I just try to tell everybody what to do. That's one of my main jobs. My name is Sharon and I work for EVS, Environmental Services. So my job description in here is to make sure the patient get to the room in time. Like means cleaning the room and make sure the room is looking good and make sure they're well clean and disinfect for the patient to get into the room. You know, that the patient can come in and they don't have to worry about germs or whatever. And as I says, that's one of my main pet peeves. Wash your hands before you enter the room. Wash your hands after you enter the room. Wash your hands after you come out of the room and all of that. And I try to do that in front of my patient, just to make that they can see that I'm doing it. Because sometimes the patient don't see it and they assume that it's not done, that we're not doing it. So a lot of time I do it in front of my patient that they can see that I'm washing my hands and making sure that we're using our gloves and making sure everything is getting clean and nice for them for the room.
Her tests come back normal today, and Dr. Bronski has decided to let her go home, but encouraged her to follow up with a cardiologist.
What I always try to think of is that the typical person had no plans of being in the emergency department that day. I come here, this is where I work, this is where I make my living, so I'm coming here every day. But most people, it is definitely not in their plan when they wake up in the morning to come into the emergency department. And when they come into the emergency department, they're sometimes very anxious, they're sometimes very scared, they can be in a lot of pain. If it's not one of those things, it's something else that they're just feeling that is not necessarily where they would want to be. And so I always try to understand that and try to look past it, because I understand that my interactions with that person initially may not be anything what they're like normally, but they're in a lot of distress. My hope is that we can get them out of that distress, and then their demeanor tends to change, and then people are very, very appreciative. All righty, we're going to get you going then, okay?
Okay.
All right.
And I don't have to come back.
Okay. Yeah. We will keep our fingers crossed. Okay. All right.
Even though I like you, I don't want to see you again.
Okay. Hopefully we'll meet under different circumstances.
Yes.
Okay. Okay, she's ready to be unhooked and go. And just get her out and make sure that she doesn't like fly back into Atrial Flutter. All right, thank you. Appreciate it.
Thank you. I am feeling good now. I'm glad I don't have to stay in the hospital, so I'm going to go out and wait for my son. Hope they can figure it out so I don't have to come in here anymore.
For those who work in the emergency department at Penrose Hospital, every day is different. Every day is challenging. But fulfilling the mission of caring for those who are ill, that's what makes every day rewarding.